That's exactly it.
It's just not work.
If you bring in lunch from Chili's instead of Costco cookies, you can even do more, you do whatever you want, right? And so like that is a factor, and on the assisted living side and the home side, like home care agencies, and this is a real issue that I think the federal government needs to be doing much more about, right? So home care agencies under their episodic payment bundle from Medicare get the highest amount of payment for wound care, right? And what's happening is that because of their own lack of expertise in wound care and their lack of staffing and their own staffing related issues, and the fact that hospitals are discharging higher acuity patients to these like thin home healths with like limited staff expertise and capacity, the home healths have figured out that, hey, if we let a mobile wound clinic come in and do 2 of our 3 visits per week, we can still get paid the highest amount and outsource the work to them. And oh, by the way, we can basically have the mobile wound clinic charge Part B for supplies. So the cost of the supplies that legally need to come out of our PDGM bundle don't come out of our PDGM bundle. And what's happening is that the mobile wound clinics are going around to these home healths and entering into standard of care contracts and things with them and sitting in interdisciplinary meetings, cherry picking patients, waiting for them to fail, the standard therapy so they can do skin subs. And there's this incredible, national, like very problematic collaboration between the home health agencies and the mobile wound clinics, which is a direct violation of the anti-kickback statute because the home health is getting paid to do that work. They're not doing that work, and the amount of money that they're saving by not getting out there with their skilled nursing visits or billing the supplies, that itself is a measurable kickback under the anti-kickback statute when they make the referral to the mobile wound clinic. And so, there is this massive kind of like issue. And to your question, that doesn't happen at the wound care center, down the road at the, hospital, right? Like, because that dynamic doesn't exist. So, that's something we think a lot about, and we short circuit, we provide a lot of education to close those vulnerabilities by which these nefarious actors are getting in and accessing these patients.
This has been really educational.